Welcome back to another YouTube video. In this quick video, we're going to review a question that's over a topic you are all pretty familiar with, vital signs. We have an entire video within our course dedicated to the normals of vitals, and then of course videos on the abnormals as well. If you find yourself struggling with this content and you haven't watched that video, please go watch that. But let's go over another type of question format here, drag and drop. Now, there are two types of drag and drop questions you may see on the NCLEX: drag and drop cloze and drag and drop rationale. Cloze just means completing a sentence. So in those, you drag a word and you complete the sentence. Today, we're going to cover the other type, drag and drop rationale. In these types of questions, you need to be able to pair the cause and effects of variations from normal seen in your clients. If this scares you, don't panic on me. We have all you need to pass your exams. Think about it like this: what will happen if something goes untreated? Ask yourself that as you go through this video. You've got this. All right, let's talk briefly about how these are scored. Remember, the lowest possible score on NCLEX questions is a 0, so you will not receive negative points. However, to get any points at all, you must have the cause correct. We're going to do an example in just a second where you will need to identify a cause and then two effects. And you're just going to drag the findings from the table into the blanks. Ultimately, you have to have the cause correct, and then you get points for every correct effect. For example, if one cause and one of the two effects are correct, you get 1 point total. If you get the cause and two effects, you get 2 points total. So 1 point per correct effect, given you recognized the cause. With that, let's meet our patient and see our scenario. So the registered nurse is reviewing the vital signs of a 56-year-old male client. I want you to pause this video, fill in the blanks from the options you are given. Due to the client's blood pressure reading of blank, the client is most at risk for blank and blank. So you're going to go ahead, use these categories below, pause this video, and pretend you are dragging these into the appropriate spots. And then press play when you have your answers. All right, now that you've had a moment to answer, let's fill this in for you. Due to the client's blood pressure reading of 135/90, the client is most at risk for chronic kidney disease and stroke. And that's due to what? Hypertension, right? And so which blood pressure reading was our most abnormal? 135/90. But we can take a step back. We can walk through all of our answer choices here. So let's start with the findings here, which is the cause, per of cause and effect. So what is considered an abnormal blood pressure? If you said anything over 120/80, you are correct. So we can immediately throw out the options of 120/79 and 90/60. And I know that one can seem a little distracting as it is low, but several people live with blood pressures around that range, and we know that low blood pressure is not a risk for any of the conditions listed on the left side. Now, 123/81, it is starting to look a little suspicious, especially since that diastolic value is over 80, but it's not our most concerning finding, right? Remember, we're looking at cause and effect here. So, what is the most likely cause? The higher blood pressure. And then effects, well, let's pause and discuss what clients with high blood pressure are at risk for developing. What do you think? Absolutely, chronic kidney disease, right? This can have detrimental effect on blood flow and perfusion to organs, and hypertension is one of the leading causes of chronic kidney disease. And then what's another possible effect from high blood pressure that's listed? Stroke. Yeah, absolutely. We worry about a vessel bursting and causing a hemorrhagic stroke. What about our other conditions that are listed? Type 2 diabetes and obstructive sleep apnea. What are these? Well, if you said risk factors for developing hypertension, you're correct. So don't get these risk factors and complications confused here. If you are having any trouble remembering these, then make sure you go back into your courses and review hypertension a little more. And then make some flashcards to get those normals down. Make sure you always know your normal ranges, as these can be key indicators of your client's overall health. Don't let these new question formats get you flustered. You know this information, and you are simply filling in the blanks here. You need to know your risks and your complications of high blood pressure and what readings you may see. And if you know those pieces of content, then you've got this. Amazing job here. And remember, you will pass.